We spend a lot of time on Breaking the News talking about mental health care in our state and nationwide because it's important to us, and we know it's important to you. And whether it's community hospitals closing their doors or staffing shortages, it is no secret that the state of Minnesota mental health care is in crisis, and it is across the country. And tonight there's new information, a report that shows that our state is in crisis, and the people in our state in these situations are spending days stuck in the emergency room waiting for a bed. And once they get one, if they get one, they're stuck waiting to be discharged. Sammy's on the show with the latest on this story. Hi, Sammy.
Hi, Jana. So health experts say this only confirmed what they already know, that some folks don't get the care they need when they need it. Delays in mental health services not only impact patients, but the systems that care for them, according to a study from the Minnesota Department of Health and Wilder Research.
The most common reasons for discharge delays were associated with a lack of available bed space in a safe setting.
Kristen Dillon with Wilder co-authored the study. She looked at 33 emergency departments around the state for 2 weeks last fall. They found 18% of behavioral health patients who experienced transfer or discharge delays during the study stayed on average 25 hours longer than necessary. The top reason for those delays, 59% of the time, an inpatient psychiatric bed wasn't available.
Those delays in the inpatient units are also causing a backlog in the emergency departments.
Once they get to an inpatient bed, there are still more delays they can run into.
I think it's a long-term challenge that we're aware of. The behavioral health system doesn't always serve patients well.
Stefan Gildemeister is the state health economist with MDH.
Ultimately, help inform policy and practice changes in the community to address these challenges.
Meanwhile, at M Health Fairview Southdale Hospital in Edina,
the empath is still part of the emergency room.
Their staff says this extension of the ER, built for people going through mental health crises, is part of the solution.
It's calm, it's quiet, the lighting is set just to help de-escalate, and that allows people to come in and not have the pressures of an emergency room.
Dr. Rich Levine and clinical counselor Michelle Snyder are senior leaders of mental health.
And on top of it, we get a therapist. We have mental health nurses, we have mental health psych associates, and then we have psychiatrists.
They say this unique system works.
Here at Empath, discharge about 90% of the patients that come through to less restrictive levels of care.
Which means they're able to keep people out of those backlogged and expensive inpatient beds. They say investment in those inpatient services is only part of the solution.
Early intervention is pivotal. It's key in people's long-term stability.
I think the study shows that there is multiple reasons that this is starting to, well, I shouldn't say starting to, has been broken down for some time.
Researchers actually suspect these delays are underestimated because they only counted patients discharged within that 2-week span of the study. Jana?
Yeah, that makes sense because we've extensively covered this, especially in children's hospitals over the last 2 years. And everybody acknowledges that it's broken. You yourself said the report showed people what they already knew, but this investment's going to take some time. Did you hear anybody talking about that?
Yeah, it's going to take a lot of time, and there are several points in our mental health system that need work. Some folks are just calling for a complete overhaul, that we need to look at this differently completely.
Yeah, especially we saw after COVID and during COVID, the amount of people that need mental health care just skyrocketed, and it's just not there right now.
Yeah, folks are starting to think about mental health differently.
Absolutely. Thank you so much, Simi. We appreciate it.